Should family members of nursing home patients have to do cares, right? Help with showers, dressing, etc. So, personally, I don't feel like families should have to do that, right? Like um insurance, private pay, all the things are paying for patients to get care. But I do know sometimes families want to do this, right? It helps them to be close to their loved one, continue to be a part of their life, and that sort of thing. So that I can understand that on the other side. One thing I will say about families providing care, and again, I might get some pushback because it's like, well, is the family member doing it because the other people won't, right? Um, one thing I will say about families like doing care and stuff is, when you as a family member get to a position that you no longer can do those showers or whatnot because it doesn't coincide with your schedule or washing of the hair or whatever it is. Sometimes, depending on the patient's like cognition and things like that, it may be difficult for staff for it to be transitioned over to staff, right? Your loved one is used to this routine with you and how you do it and how you know, maybe use things to encourage them to take a shower. And so sometimes it is really hard for patients to go back and transition to staff doing that. So, again, I completely get it that sometimes families step in because it's not being done or it's not being done to your preference or not enough or whatever. But, in the instance that you can't do those things, it can create a situation where the patient is not getting enough showers or whatever because again they're declining which to shower, which is their right, because they're used to a certain process or a certain person doing it. What's your take on it? Do you think families should be having to do cares for their loved one that lives in a nursing home?